Hello. Our group was given the population of cerebral palsy. Our goal is socialization, and we are achieving this goal through the activity of adaptive bowling.
Cerebral palsy is a permanent movement disorder that is often seen in early childhood. Approximately 2% of the cases have been linked to inherited genes. Often, cerebral palsy happens during pregnancy or after birth. Cerebral palsy is usually caused by damage to the part of the brain or some type of abnormal development. There are risk factors which include twin pregnancy, difficult delivery, and trauma to the head. To find out if someone has cerebral palsy, observance child development is looked at. Medical imaging and blood tests to rule out other causes. In some cases, cerebral palsy can be preventable by suggesting certain shots to caregivers and preventing head injuries in children. There's no cure, but medication and treatment can be helpful. Some patients find the following as helpful in managing their cerebral palsy. These include speech therapy, physical therapy, and occupational therapy. Medication can help relax muscle and reduce spasm. Surgery can be done to cut active nerves and help lengthen muscles. Cerebral palsy is the most common movement disorder in children with at about 2.1 per 1,000 births.
I'm going to explain what cerebral palsy looks like. Signs and symptoms can vary greatly, but some of the more common symptoms include impaired movement associated with abnormal reflexes, variations in muscle tone, such as too stiff or too floppy, lack of balance and muscle coordination, ataxia, abnormal posture, involuntary movements, unsteady gait, delays in reaching motor skills, milestones, such as pushing up on arms, sitting up or crawling, difficulty walking, such as walking on toes, crouch gait, a scissors-like gait with knees crossing, a wide gait or asymmetrical gait, speech impairments, learning difficulties, or difficulty with fine motor skills, such as buttoning up clothes or picking up utensils. CP can affect the whole body, or it might limit it primarily to one limb or one side of the body. It is non-progressive, so it does not change with the time, and symptoms usually do not worsen with age. Brain abnormalities associated with CP might also contribute to other neurological problems such as difficulty seeing and hearing, intellectual disabilities, seizures, abnormal touch or pain perceptions, oral diseases, or mental health conditions. Typically, individuals living with CP can or will use either a walker, canes, or a wheelchair for mobility.
Hello, my name is Ren Young, and I'm going to be explaining the general goals of how recreation therapy can apply to people living with cerebral palsy. The following are the goals of recreation therapy that I will be talking about. First goal is minimizing a child's disability by teaching him or her adaptive strategies. By teaching them new ways to use technology to assist in the individual's daily life and adapting multiple things to better aid someone who's living with a disability, allowing them ease of access to things they need to use each day, such as voice to text or adaptive keyboards and mouses. My group partner Toby will be explaining more about specific adaptive strategies used for bowling with people living with cerebral palsy. The next goal is motivating a child to take part in activities with encouragement and support. Some ways to accomplish this is by having a positive attitude, by cheering them on and getting them excited to actually do the activity. For example, using encouraging words and motivational phrases are a good idea, such as as well as giving positive feedback. Another goal would be modifying the process and procedures to enhance inclusion. Inclusion is one of the most important goals for individuals living with disabilities. We can do this by adapting strategies to ensure that everyone has an equal chance to participate in an activity. This is allowing them to feel included and part of a community and giving them a sense of belonging. The next goal is expanding a child's ability to socialize and make friends. The goal that we will be covering in more detail is the goal of socialization. By being able to fully participate in activities, it allows them to gain confidence and self esteem, which helps them feel included. Another goal is for determining a child's capacity for recreational performance. When choosing an activity for individuals with CP, you want to ensure that the activity is suitable for them. You want to choose an activity that is within their physical and mental limits. For example, for folks living with CP, we typically see involuntary and rigid movements, so we would consider this when looking at recreational activities. You may not want to have an activity that involves fine motor, as this can be discouraging and frustrating for the participant. In addition to this, we also want to enhance a child's self concept and self confidence. This can be obtained by adapting activities to suit the needs of those with CP. You are helping to build confidence, and by doing this, you're increasing their self concept and improving their beliefs about themselves, helping them build self esteem. This helps the participants to want to continue participating in these activities as they are succeeding in it. This boosts their motivation as it gives them a sense of accomplishment and increases the feelings of wanting to do the activity again or attempt other activities. And finally, the last goal I will be covering is helping a child develop interests. You can do this by helping the child to fully participate in an activity to grow their interests and wanting to participate in other activities. If they do well in it, it helps to increase their interest in new activities while building confidence in themselves and allowing them a greater range of activities they can do.
Hi, my name is Toby. I'm doing our presentation on how bowling helps promote socialization in people with cerebral palsy. Today, our group has been given a task to plan a recreational activity for people with cerebral palsy. Credit to Riley for all the pictures he researched for our assignment. The reason this activity was chosen is because bowling is easier on the participant's body, using gross motor skills rather than fine motor skills. People with cerebral palsy do not usually have smooth and steady hands. Often their movements are spastic and jerky. As a recreational therapist, you would want your participant to enjoy the activity and not be bothered by if they are doing it right. This stress would be hard on their brain. Bowling allows them to participate in an activity which I feel is inclusive. Bowling can be adapted to them due to the equipment, which allows them to easily participate with others. Some of the equipment we would adapt would be the VersaGrip ball. This ball is easier to hold and grab onto, and the other option is retractable handleball, which is easier to grab onto for people with cerebral palsy, as they do not need to put their fingers in the holes, and they can hold onto the ball with both hands. Lighter pins would allow the participant to enjoy the activity because they are easier to knock down. Velcro shoes would be easier for our participant to put on, and a bowling ramp is another way this would allow the participant to enjoy the activity. Again, another reason why adaptive equipment is important for inclusion. The goal with bowling is socialization for the participants. Bowling is a good activity for socialization because you get to be with other people who may be your friends, and some you may make new friends while staying close with the friends you already have. Friendships are about socialization. You can join a league or a team. Participants may find a lot of enjoyment out of this activity and may want to join a team or a league. Being on a team would allow the participant to feel like they are a part of something and make them feel inclusive. When you bowl, the lanes are close to talk to other bowlers beside you. It allows the participant to be a part of the activity. With bowling, you can be more socially active. Example, order food with friends, sit and talk. For people with cerebral palsy, it allows them to get out of the house and into society. It also allows the participant to make and meet new friends who also have the same struggles as them. This could provide the participants support and know they are not alone and that there are a lot of other people going through the same struggle. This would also allow the participant to feel like they fit in, which is key in today's world. I have some examples of some equipment that the participant can use. This one is a ball pusher. So it's a stick that they would hold on to, and they would push the ball with the stick down the lane. On the bottom here, these are gutter bumpers. These would allow the participant to push the ball with the ball pusher and not worry about the ball going down the gutter. This right here is a ball ramp. So if their arms aren't as physically fit for a ball pusher with the rod, they can hold on to the ball and put it down the ramp, which would also allow them to participate in the activity.